Good morning and good afternoon to all our fibromyalgia and lupus friends out there. This is the Community Connect Live with Looms for Lupus and Support Fibro. I'm Melissa Talwar from the Support Fibromyalgia Network. We are a nonprofit organization focused on fibromyalgia advocacy, research, patient and medical education. And I am joined by my good friends, Looms for Lupus.
Hi, good morning, everyone, and happy Friday. I am Estela Mata, one of the co-founders and support group facilitators, and I also live with fibromyalgia. So Looms for Lupus is a nonprofit organization that was created by my sisters and I to support those living with lupus and overlapping conditions such as fibromyalgia, their loved ones, and caregivers.
Good morning, everyone, and good afternoon as well. I'm Juana Mata. I am the co-founder or the other co-founder of Looms for Lupus. I was diagnosed with lupus in 2009. And since then, my sisters and I have been advocating and supporting others living with lupus, their caregivers and loved ones.
Well, I'm glad everyone could join us. Please just know that this participation is highly encouraged. So please leave comments, share with us. Just want to check in with our community and see how you're doing this morning. Are you energized and ready to go on this Friday like Estella is with Happy Friday? Or are you like me and falling behind because you have not had some great sleep? So if I can tell you guys something, I was washing my hands, right? So I'm standing in the bathroom washing my hands before the show, and I see my hair is out of line. And so I didn't finish rinsing my hands. So I'm all trying to touch up my hair, and there's soap all in my hair. So I didn't have time to rinse out my hair. So it's like, I think I have soap over here. So that's how sleepy I am when it comes to that. So if you're feeling the fatigue, leave us a comment, or if you're ready to get the weekend started, leave us a comment either way and join us. Tell us if you're drinking coffee or tea this morning. So participation will be highly encouraged for what we're going to do this morning.
The good thing, Melissa, is that soap on the hair actually makes it like sleek. So you have a sleek look while I have a little frizzy look. So maybe I'll try a little bit of soap next time.
I won't talk about my hair. All I do is just put it up in a bun. And I did dyed it. I was already getting the dark roots. So, but that's all I do with my hair.
I love it.
Both of you always look good on screen. So I think we need to have this new talent of sharing with us how to look good. Maybe there's some way down the road to have fashion through a Zoom call, because I'm going to need it for some upcoming meetings. And I was noticing it always looks like I'm wearing my pajamas. Even though I'm wearing a nice sweater, it still looks like I'm wearing PJs because I've cut off like... So, and I'm a disaster with makeup. So we just need to figure this out. And COVID hair is just, not feeling it right now. But I'm excited to be back doing this for the new year. And, we're going to start off the show with some updates and shout outs for organizations. And then we're going to get into some more updates on conversations on COVID-19, just some of the information we joined in with like Creaky Chats. So again, feel free to post comments, share this video with all of your lupus and fibromyalgia and chronic illness friends. We really appreciate it.
Yes. Okay. I could go ahead and get started really quick. Okay. I just want to give a shout out. Well, one, I want to give a shout out to you, Melissa, and to my sister, Juana, for always working together and, getting together to bring these updates to our community. So I'm so grateful to have both of you guys here and to share the screen with you guys all the time. So the first shout out that I'm going to be giving is to House Foundation, to Kimberly House, and they are the creators or organizers of the Lupus Project, which will be coming up next month on the 25th, I believe. And I'll just confirm the date. Let me confirm it because I Just had it 2 seconds ago. And what the Lupus Project is, so registration started on the 17th of January. And what they're doing is they're going to be giving away a couple of, I think it's 100 boxes for the first 100 people that register. And whether you have lupus or overlapping conditions or have a loved one that has lupus, you guys can join as well. It's going to be virtual. And what it is basically bringing the community together, where lupus organizations from all over here in Southern California, and also other organizations that help, like CBD, therapies, different modalities that we can utilize as caregivers and also those living with lupus. So it's an awesome, awesome event. It's going to be virtual. It's going to be next month. So look out for more information because, of course, Looms for Lupus and Melissa from Support Fibro, we are going to be part of this amazing event. So that was my first shout out.
Well, and we'll be sure to include the link for that so people can register for the event. That's actually flashback to a few years ago. That was the first time we've ever met in person. We have a picture together, right? Because I think we got connected virtually through Christine on a call, but I finally got to meet you in person at the Lupus Project, and it was good. I mean, they had an interactive workshop live. I got to speak to a dentist, a biological dentist who worked with lupus patients. And then, they had different products. They had different advocates. Lupus Research Alliance was there and other people with booths. So it was a great event.
Yes. And, one of the things that I loved is last year, we were able to provide an in-person support group in Spanish, which is another one of the things that we offer, Looms for Lupus, Tejiendo una Comunidad de Esperanza. We support those that also speak Spanish. So it was really great. It's been great. This is, I believe, the 4th year that we've been part of this amazing project. So we're just excited to have that, next month as well.
That's fantastic with an update. Okay, so let's go to I was going to say something and I lost track of what I was going to say. Oh, because I started thinking about yesterday because I was watching Juana's feed and she posted a video of you speaking, Estella, for the All of Us Research, right, program. So were you guys both involved with that? Are you both involved with All of Us Research?
Yes, we're both involved. I'm part of 3 different groups. I'm an ambassador for the NIH and All of Us Research in is it Atlanta, sister? Yes. Atlanta. I'm also involved with a virtual All of Us Research in San Diego and with the All of Us Research in LAUSC or the KEC, LAUSC. So we're very involved. We speak on different platforms, and we also share, and we go to different meetings to learn more about the All of Us Research, and we give our feedback.
Yes, and what the All of Us Research program is basically an NIH or the National Institute of Health it's one of their biggest funded projects where they're trying to get 1 million. The goal is to get 1 million people to enroll and just from different backgrounds, different diversities. And right now their goal is to reach 1 million people. And right now they're over 370,000, I believe, which is amazing. This is their 3rd year. And basically what it is you volunteer and it's free. You give your saliva and or measurements. And it's basically going to be a big hub for different researchers to have and scientists to have the ability to tap in to this diverse hub and do their research. Obviously, all the data is secure. Everything is private. Your name, nothing is disclosed. And the good thing about it is it's also for precision medicine. And what is precision medicine? It is basically individualized medicine. So medicine or treatment plans specifically for me as an individual versus my sister or you, Melissa. So that's where, one of the things or one of the goals is, and not only do you share your DNA, you share your electronic health records. And, if you have a Fitbit, you could also track your heart rate and all of that. So it's amazing. And I joined because my sister joined first, and I am one of the virtual advisors teams member. And, Christine von Reisfeld, who has talked about precision medicine and pharmacogenomics and all of that, which I know those are big words for everyone, which is why, and that actually takes me to the next thing. But so Oliva's research program is amazing. I'm actually going to be speaking again today to another group. So it's always great to be able to share your story of why you're joining. Why is it important for people like me, a Hispanic female, to be represented in clinical trials or research or studies? So that's, it's pretty amazing. Not only do I represent myself and women in the Hispanic community, but I also represent a diverse group of patients that are doing this. And guess what? I get my results from my DNA and all of that I can bring back to my doctor as well, so I can have better.
And now they're also doing the ancestry now, and they also do have doctors that will speak with you regarding your genetics or any conditions that might be seen on the DNA or the traits.
Yeah, the genetic counselors.
Yes.
And it's all free, which is amazing. And regardless of your gender, regardless of the community, LGBTQ, whatever community, rural communities, anybody can join as long as you live in the United States. And regardless also of your immigration status, like they don't ask you for anything like that. And you can do everything from home. You enroll, you watch the videos, and you participate. So, it's a great way to give back to the community.
So this isn't just for lupus patients, correct?
No, not at all.
They're trying to get the 1 million people, and you don't have to be sick to actually participate. And because of the pandemic right now, you don't have to go in person to get the saliva kit, because that's what most of the time, that's what they're doing right now, right, sister? That they're sending you the saliva kit, you would send it, and then they'll talk to you. You'll go over the videos to learn more about how and what you're going to be participating in.
Yes. And again, if anybody wants more information, I will actually, the one that I'm going to be speaking on today is a close group, but next Thursday, I will actually share on social media. So everyone who wants to join, it's a free Zoom informational video. It's also going to be talking about the Oliver's research program, why I participate. So I'll invite everyone and I'll post it as well. And we can provide the link. So if people are interested, they can, visit the website and get all the information that they need. So, just so excited to be able to participate. Again, if you're healthy, if you're sick, if you have an autoimmune condition, or if you just, don't even know if there's anything good or wrong with you, you can participate, which is the best thing.
Well, we'll be sure to look out for that so we can tune in on Thursday, and we'll share on our pages and in our groups. So that was definitely an interesting update for all of us to join and participate, get our families involved, and that way we can get them to their 1 million mark. I did want to give a quick update for our fibromyalgia community. Tonix Pharmaceuticals is currently enrolling participants in a phase 3 trial for fibromyalgia. This is called the Rally study. And in no way did they reach out to me. So I'm just putting it out there because it is few and far between do we have fibromyalgia updates like this. I guess they pushed through. They had a previous study, and I'll probably do a complete video on this going through some of the first study. It was called Relief. So they did a 14-week trial called Relief and had 500 participants. And what they're testing is a sublingual version of Flexerol, and I'll use that name as opposed to the medical drug name. So that's the generic name is Flexerol, which some of us have tried in the past, including myself. So right now they're currently recruiting for another second 14-week trial called Rally. And I did include in the description, but we'll add more information, and I need to go through more detail. I started to look at if I was eligible for this study. I think the closest place that I could participate was Santa Ana. So I'm not sure what they're requiring at this point in time, because that is a drive, a little bit of a drive for me. but I'll do some more information, dig in a little bit more, and report back to all of you with, possibly do a separate video as well. I know that I've used Flixerol, I think when I was younger, and it really knocked me out. But then as I got older, for some reason, when I did a half version of it, it kind of helped with sleep. So I'm curious as to where they're at with this newer version. So it's kind of interesting for that. But that's an update for our fibromyalgia community. I know that all of us together, we wanted to give a shout out to WeGo Health. So I know it was WeGo Health winner a couple years ago in 2019. It seems so far away. And then Estella was a nominee this past year. So just shout out to them a little bit. Have you guys participated a lot in the WeGo portal?
You know what? I like to go get information every now and then and watch the videos, and it gives you like points. There's like a point system, so we can also share that information. So this is basically a platform where patient advocates empower each other. We learn from each other. We learn how to be better patient advocates. So if you guys saw, I shared, I think it was like a 30-second video of why I'm a patient advocate. And so I shared it, I think, on Looms for Lupus and also on my page. So it's a great way to connect and empower and support the patients, the different patient communities and advocates. And yes, I was one of the finalists. I'm just so excited that, the WeGo platform has this way for patients to amplify their voice. And I never popped my WeGo confetti, because I was planning on popping it if I won. And then I realized, like, looking back, I should have just popped it when I got my WeGo t-shirt, which I'm not wearing today, but I should have just popped it.
I didn't pop mine for 2019 because I don't want to clean up that mess. Who's going to clean it up? No, like, I know probably my dog would try to eat it or something.
Yeah. It is.
And shout out to like Dion, who is watching too. He was another finalist for WeGo.
Yes, he was.
Maybe I can pop it tomorrow on her birthday.
Well, how about when we can come together after this is all over and we meet up? Let's just pop it like when we finally
had to. When we all meet up in person.
Yes. So instead of a bottle of champagne, it would be like, we'll do that. Big celebration.
Well, we'll see. If I can hold back and not pop it tomorrow on my birthday.
Oh, that's right. Happy birthday celebration. So everybody wish Estella a happy birthday. We won't ask you what birthday it is, but it's just a happy birthday.
I'll tell you, I'm actually going to be 47, which is quite interesting because if you would have asked me last year I was saying I was 43 and that I was going to be 44.
That's what she told me, everyone. So
But no, I am going to be 47. But, another thing that I wanted to bring up and I wanted to give a shout out to, even though I want to continue focusing on my birthday because, I'm just so grateful to have another birthday. But I wanted to give a shout out to Kelly Rosetta from More Than Lupus because I don't know if you guys tuned in, but we had a minority group, a series of webinars on how lupus affects the minority communities. So we're also going to be partnering with her again, and we will have the first of the 3 sessions on February the 27th, which is next month, and it's going to be on how lupus affects the African-American community. So it's just a great way for us to also bring and highlight how lupus affects the different minority groups, the African-American community in February. In May, I believe we're going to be doing the Asian American and Pacific Islander, and then towards the end of the year, and how it affects the Hispanic and Latino community. So it's just a great way to be able to bring support for all the communities.
We are going to be busy because we have the Fibromyalgia Impact Tour coming up. So everyone tune in. We're definitely going to be addressing food insecurity, health equity, and talking about quality of life for fibromyalgia, lupus, and other autoimmune conditions. You're going to hear from people that are making an impact in their community and what we can do, resources that need to be funded more or resources underutilized. We'll get to the bottom of all of that. and kickstart some research for our community that we're going to be doing on our own. So we're pushing forward, and I'm excited to be working with Looms for Lupus. You're going to see them all over our Support Fibro page coming up. And it looks like they're going to be busy out there too with the Lupus Project, More Than Lupus. So there's never a shortage of content and stuff for people to watch and learn from. So please tune in and participate, share with all of your friends.
Yes, and it's amazing because I was talking about the tour, the Support Fibro tour, and I'm just looking forward to see you in action. And I want everybody to be able to, enjoy and learn, because a lot of the things that you bring, Melissa, it's not just like, hey, I'm supporting the fibromyalgia community. You're supporting the autoimmune community. You're supporting the lupus, the fibromyalgia community, and the rural communities, and those that are having, issues, whether it's with food or whatever it is that they're going through in the community. So that's like a bigger, kind of like you're covering a bigger, I want to say community, or more of the community than just a specific illness or specific disease. So I want people to understand that this tour that you are having and you're creating, and you're going to bring on other different organizations, it's not just based on one specific condition.
Correct. And I mean, now you can understand why I have lousy sleep. There's a lot that I want to cover, and there's a lot that we have to do just because I want health equity for everyone, no matter what your zip code is, no matter where you are located too, and just being able to help you get the resources that you need as patients, and making sure you have access to quality healthcare is super important, because I don't want people left behind. I know I've been to events of women of color type events for autoimmune conditions, and I've seen some of the, and I've listened to their what they shared with their experiences, and it was really upsetting at times to hear people and how they were so discounted. I mean, as women, I think we also get discounted, especially with our emotions. It's like, oh, it's all in your head. But, and even on the men's side, to get the men's health going when it comes to that, and how prevalent everything is. I noticed different comments. I think Emmett posted a comment the other day on Share Your Illness, and I saw how many people have these combinations of disease diagnosis, and fibromyalgia was honestly right in there with a lot of the lupus. It was almost like every other person, and then even down below. So we got to do something to help our patient community make sure that they get the quality care that they require.
Yes, definitely. So that's why I just wanted to make sure that you understood what this project and this tour is about, because it is gathering a lot more than just, again, one simple autoimmune or one condition. It's about helping the community. And, that also brings me, I know we're talking and we're throwing big words, the pharmacogenomics, the health equity, what do all these words mean? And that again brings me to the next thing. Coming up, and look at our platforms, because we are going to be providing information in regards to all of these terms. What does it mean? What does step therapy mean? Do you have a right as a patient? What is going on with the new laws? Like, are things going to change? New policies? How are they going to affect you, the disabled? How is it going to affect you, the person that's on either Medicare or these specific insurances? What does a copay mean? What are all these things mean? And all of this is going to be brought to you through different partnerships. So we're going to be partnering with Liz Helms from the California Chronic Care Coalition and other organizations, My Patients' Rights, to bring you the information that you need as a patient, as an individual, as a caregiver, to be able to empower you, so you know that you're right, how to kind of face all the challenges that sometimes come with dealing with healthcare.
Well, and not to jinx any of our situation, but I won't say the name, but I'm excited that all of us, or the three of us, are actually accepted into an advocacy masterclass program. So We are definitely going to be learning quite a bit on healthcare policy and all the terminology from this particular master class. So we'll be sure to share that with you. I know I'll be babbling on forever. So I think my family will be sick of me probably after through the 14-week course, but we'll be sure to share that information with you because that's part of what we're doing here, making sure it's accessible to all our community. It's not just a barrier for a select few patient advocates to learn. We want everyone to be involved with advocacy and getting the help that they need and the resources that they need.
Yes, definitely.
Now, I know the hot topic right now is this pandemic. So I happened to join a Creaky chats on this about vaccines and are you getting the information? So we wanted to bring that kind of to the conversation and to our community. Or if you're a lupus warrior, fibromyalgia warrior, please leave comments for how you're feeling right now, how you're feeling about the vaccine. I know there's different tiers of this. So there's people who are just gung-ho, who are going to get the vaccine regardless of you'll never change. And then there's the other spectrum who will never get the vaccine. But there's a lot of us in the middle who are confused, want more information, are kind of maybe like me, who might be a little bit terrified because we have severe allergies to things. So I think continuing to share this information about what's going on is important. So we wanted to throw that out here as the next part of our Community Connect. And please, again, join the conversation with your comments and tell us how it is in your area with vaccine distributions. I know California, but what have the both of you seen right now when it comes to all of this?
I can start. So one of the things that, I have been researching. So right now there's two. There's the Pfizer and, oh my gosh, the Moderna. I'm like, it just went away, my fibro fog. But yeah, so the Moderna and the Pfizer are the two that are out there right now. So I know a lot of people that are, I work in healthcare. So it's being offered to those that are working the front lines. So for me, my husband, he works at a healthcare facility. So he got his first dose and his second dose already, and he got the Pfizer one. And if you're doing your research in regards to the differences between both, what I have found, and again, this is just, we're not getting paid by any of these organizations. This is just us sharing information of what we've learned. I encourage you to go specifically to the CDC website and go to places that are that you can trust, that you're going to get the real and the good information or trustworthy information. But anyway, so there's two, right? So one of them did not include a lot of those living with autoimmune conditions. So, and the other one did. They both it was a huge, there were huge studies done. There were diverse studies, but that's one thing to look at. One did include, again, autoimmune conditions and the other one didn't. So not to say that one of them is more effective than the other. I know people that have gotten the Moderna and some that have gotten the Pfizer, and a lot of the side effects have been just soreness on the arm for a couple of days. Some people have gotten headaches, chills, almost fever-like symptoms, but not fever, like just the chills and the body aches. And it only lasts for a couple of days. And why am I sharing that? Because a lot of people, I've seen so many, like I'm on TikTok, I don't post anything, but I just watch. And people are making fun of like, oh, look, my husband was fine or my wife was fine. Then she got the vaccine and look at her now. And it's just all fake. It's like they're like twerking their bodies or they're dragging their legs. And, it's just sad to see how people are taking this to another level when there are so many people that just want to know, like they're in the middle, like you said, Melissa, they don't know if they should get it. They're afraid. And it's good a lot of people have a lot of questions. I had a lot of questions myself. How did we come up with a vaccine so fast, right? And a lot of the times, the reason why these vaccines take forever is because trials take forever. To recruit diverse communities to participate takes sometimes years. So the difference with this study was people were signing up to do it. Yeah, so they didn't have to do that.
Well, now you have an answer to that. Because I guess with the previous SARS, they already had a head start. So that's where there was a miseducation on like, okay, how did they get this so fast? And in my research, I saw that previously the SARS, so this is SARS-CoV-2, but the previous, they already were working on a vaccine from that. So that's why they've had like a 10-year head start. So it wasn't just like they magically came up with that. So that was something that came up in my research to answer that question, because I think we brought that up in a previous call and a previous conversation. So that's for that information.
Yes. And you see, this is why I love, Melissa, you go in a little bit deeper, right? And I love that we're able to get all this information and talk about it, because not everyone will read or has the time to go in and read. And this is what the Community Connect Live is about. We don't want to lure you to doing one thing or another or recommending one or another. We just want to provide you the information. But yes, and also the funding, as Juana was saying, there was a lot of funding done. And the reason there's so many vaccines that are being, now dispersed and all of that is because the funding was there. So there wasn't like you didn't have to search for funding. You didn't have to search for people. And obviously it was something that had been started already. So they just kind of revamped it. And so, for me, I would get it. I would get the vaccine, and, I'm not, again, that's just me. And why would I get it? I had COVID. I had COVID in July. And I could not breathe. I thought I was going to die. I was afraid of being hospitalized and being intubated and not being able to see my family and not being able to come home. So for me, it was scary. I lost my hair. I still have side effects. I have major fatigue, major swelling on my eyes, headaches. There's just, you have so many things that are happening to people. We lost my cousin, my first cousin, to COVID. He had no underlying conditions, so it's just scary. My daughter still can't smell. It's just something so scary. I don't want to get sick again. So if I have the ability to get a vaccine that is going to help me 90-something% of, immunity, I'm going to take that chance. So, for me, again, and I'm not trying to, tell you what to do. Just get your information. I did my research and I decided that I'm ready for it. So my work actually sent me an email so I could let them know if I am interested in getting it. And they did ask me a couple of questions, which was really interesting, because I don't know if that's what they ask you. When you get a vaccine, they ask you, like, have you had a reaction? Are you allergic to egg and stuff like that? And I know, Melissa, you've had reactions with vaccines. One of the interesting things that it asked me if I had a platelet disorder, or if I had HIV, or if I was on specific treatments. So I had not seen that question anywhere. So I answered it. I don't have either, but I do want to encourage, again, people to do their research and find out. So I'm going to go research a little bit further, because I saw those questions in my questionnaire and I just thought it was interesting that they were asking me that. And I know Juana has that rare condition of ITP, the platelet, it involves her platelets. So I'm just interested in learning more about it.
Well, from the beginning, when I heard about the vaccine, I definitely said that I was going to get it, because like Estella, I've also had COVID, and the symptoms are not fun, and it's scary. And it's not only affecting your physical body, but it's also affecting your, emotionally. So definitely my decision was is to have the vaccine. I haven't scheduled my appointment, but my work already cleared us, the department that I work for, that we're ready to, if we are willing to get it, that we can go ahead and schedule our appointment. I will be scheduling mine very soon, but I do have, like Estella said, ITP, or a thrombocytopenia. I did ask my doctor about having any concerns as to getting the vaccine, he did say that I should be okay. It shouldn't affect me. And but now I'm kind of thinking about what you just said, Estella, that, that's one of the questions, because I do have ITP, and the last thing I want is to go back to the beginning when I was first diagnosed with lupus and having the low platelet count. That's scary. And for me, it seems that it always goes to the extreme, to where I get very ill. So that's one thing I don't want to go back to. And definitely I will have to read a little bit more, do a little bit more research as to the ITP. And but my doctor did say that it was okay for me to get it.
Well, it's interesting you bring this up too, because I know I'm probably more on the skeptical side of the spectrum. I question everything and I don't trust anyone's information. I have to dig into the science of everything. And I do challenge a lot of organizations out there to put out better education, because I have not seen the education that I want to see. And I know that I've reached out to some of my providers and they're just as confused. So like they're giving me top level, but they're also either on a spectrum of, oh, all 4 vaccines, or don't completely get it. So I've been trained by some, like there's providers in the community of functional medicine say absolutely not. So where is this education information? I think for providers and patients, it's a, we got to stop the shaming too. This is a personal decision for people to make and to weigh out the risks and benefits. Like I have not had COVID-19, SARS-CoV-2. I don't want to get it. The risk is really high for me based on what I've seen and based on my genetics. And then I have 2 parents with immune conditions here in the house. So I'm weighing out the risk benefits right now. If it'll decrease the severity of, the infection, then yeah, maybe that's risk, even though I've had previous allergy reactions to flu shots that put me in the hospital. I don't know why that happened though. I wasn't very diligent with asking those questions back then in college. But what's that risk benefit to each person when it comes to this stuff? So I think it's a personal decision for all of us to make. And I just encourage everyone to make those decisions. If your provider is knowledgeable, and if you're not sure yet, please seek out more education and just understand each of us is going to be different. I will say for anyone that's concerned with the allergies, to please let people know wherever you're taking the vaccine that you need to sit there for 30 minutes. Not 15, because I've heard stories and I've read the documentation on the allergic reactions. There was actually a woman in San Diego. She started to have a reaction at the 18-minute mark. So if she had left at the 15-minute mark, which they encourage, she would have had a reaction while driving home. So for all of you that are kind of hesitant with immune compromised systems and stuff, please just encourage your doctor to just let you be for 30 minutes. Make sure you free and clear with that, and just talk to your doctor about your concerns, or find other resources that you can have open discussions with. And, if anyone's out there, please leave a comment if you want more information. And we've been digging in. I know all of us have been digging into the research, and there's different communities, but I strongly encourage other organizations out there, please put better education out there on the science. Don't just say, go to your doctor and have conversations, because I'm struggling. A lot of people are struggling with that, and, struggling with actual doctors understanding your diagnosis. Because I know in our fibromyalgia community, people are getting discounted that that's not an underlying condition that you need to worry about when it comes to, and I completely disagree with that. So I think based on and I've even heard people with arthritis who are getting oh, that's not considered an underlying condition you have to worry about. I'm like, okay, so it's kind of messy out there with information.
Yes, I agree. I agree with you 100%. And again, our decisions, what my decision is should not, I don't want to influence anyone, or stray them or with the information that I just provided. But it's just, it's a good way to just find out and ask those questions. And everyone is unique. And, I do believe, like you, Melissa, fibromyalgia is, it's not looked at like an autoimmune condition. They can't even get it together as to what fibromyalgia is. But I can tell you that my fibro fog has almost tripled since COVID. And I can tell you that my hair loss, like every symptom that I had before with fibro, whether it's my aches, whether it's my pains, my fatigue, it's gotten worse. So, if you believe it or not, let me tell you, if you have fibromyalgia, it is a real condition.
Well, and what's the number one thing they tell you to get to improve your immune system? Sleep, right? And so what's the top conditions that fibromyalgia people struggle? It's unrefreshed sleep.
Yes.
Can you imagine though the next day you're getting a vaccine? Do you think I'm going to be sleeping? I don't know. If all my fibro warriors out there, are you having trouble sleeping right now? You think if you're going to get a vaccine the next day, can post in the comments if you'll be able to get sleep the night before. I don't think I'll be able to. But I mean, yeah, that's how it's like. So that affects my immune system, right? So I'm going to be going into a place that probably have no sleep.
Yeah, no, definitely. But you know what? The good thing is that there are some resources out there, and hopefully coming up soon. I know they're working on an organization's working on getting the information out there for people like us that are in need of that information, that can't just call our doctor to have this discussion. And you know what? Some doctors, believe it or not, don't even believe in getting vaccinated. So we look up to providers, to nurse practitioners, to nurses and physician assistants, and some of them are not even getting vaccinated. So, just throwing that out there. So, I know our friend Christine von Reisfeld from People with Empathy is working on getting some providers to just come up and say, why? Just share, why is it that you as a provider are not encouraging this? So it'll be interesting to see and hearing it from the horse's mouth as to why, even though they're providers, they're choosing not to. And again, I'm not saying it's a bad thing. I'm not saying it's a good thing. We're just bringing the information out there because this is what's happening in the community. And yes, please be respectful. Just because I choose, or I told you I chose to get the vaccine does not, mean that, I'm opening myself for you to tell me if it's right or wrong. I mean, you can tell me if it's right or wrong. I just encourage you not to do that because, we have to be supportive of one another and not be divided. And in order to support one another, respect is a huge part of, any sort of relationship. So again, it's just, we can go on for hours on this topic because there's just so many things, so many questions, so many unknowns. But, the good thing is that, we will try and get you as much information as we can.
Right. And with your decision, don't let anyone else, tell you what to do. You do your research, make your own decision, and whether you want to get the vaccine or not.
Well, and I know that there's a lot of questions on what category people are into, so that comes up, and I think each state is very different. I know we're in California, so I think they've lowered it to 65 and older. I'm not sure what they're doing with immune compromised. I don't think that that's on the list yet. It is very confusing. So that's why we also want to bring the information out, because I've heard in other states, some people have been able to get that. I think it's just, we want to see some better information out there and just having conversations. So please be open to having these conversations together and no shaming, please.
The last thing we want is to create more stress because, it flares all of us up. Right. And let's see, what else do we have? Any updates, any other updates, Melissa?
I think we're heading in close to the 45-minute mark. So yeah, I just, stay tuned for all our content. Please follow all our pages. Let me just put some banners I put the websites, but you can follow us on social media because that's where we do a lot of our activity for upcoming events. Please, I encourage everyone to join the Limbs for Lupus support group. It's the second Saturday of every month, and I'll let you guys explain.
Yes, every second Saturday of the month, we partner with Lupus LA, so support group for lupus and fibromyalgia and overlapping conditions. Every second Saturday of the month at 9:30 a.m. via Zoom. That is not live, and none of the information is shared. And then we also have the Spanish support group at 8 a.m. every second Saturday of the month. And that one's transmitted via Facebook Live. And then the other thing that I wanted to share with you guys really quick is that, oh my gosh, just forgot. Oh my gosh, I completely forgot. Oh, Mental Health Mondays in Spanish. We did the series in English for Mental Health Mondays, and we are now doing the Spanish version. We're just trying to confirm the person that's going to be speaking this coming Monday on Facebook Live at 5 p.m. If we do not confirm it, I'm still going to go on there. So I just want to give everyone a heads up. If you guys want or have anybody that speaks Spanish that wants to learn more about mental health, please reach out to us. Mental health is as important as physical health. And right now, dealing with all of our chronic conditions, plus the pandemic and COVID-19 and the stress of getting the vaccine or not getting it, our hair not being right, our hair being wrong,
Soapy hair.
Yeah, soapy hair, frizzy hair, falling, my hair falling, like all these things. Just know that we are here to support you.
Well, and stay tuned for the Fibromyalgia Impact Tour. We're excited. This is the first part of it, and then we'll move right into May. I'm excited about planning May. We're working with Crystal Kent from the Fibromyalgia Pain Chronicles and the Veteran Voices for Fibromyalgia. So kickstarting all this advocacy. She's connected us with some great mentors. They're going to talk about more of advocacy. We're going to have proclamations going, led by our beautiful Juana, who led the way this past year, even through the pandemic, to have these proclamations. So everyone get involved. If you're lupus, fibromyalgia, May, I even talked to a Lyme warrior too. So it's going to be a huge month. Let's all work together towards that. I know it seems far away, but we're already close to February. So lots of advocacy coming up, and stay tuned because we can still do all these virtual advocacy events, even during a pandemic.
Yes, definitely. Looking forward to all the fun activities, virtual activities that we have coming up for you.
Yeah, and please reach out if you're interested in getting involved. I know that there's a lot of organizations out there across the country and internationally too. We want to include you, all of you advocates out there internationally as much as possible. So don't hesitate to reach out. Love to have you as a guest on Community Connect, which I think we're switching to Community Impact, right? For the work.
Oh my gosh, we forgot the most important announcement, which is
we'll have a kickoff event with all of you talking about Limbs for Lupus Impact. But yes, we'll switch it up.
Yes. So just stay tuned for more updates on what we're doing and on the tour, because you're coming with us.
Yes, it's going to be a virtual tour. Like, my dream before all of this started was that Juana and Estella could be on the road and we would be meeting all of you in person for workshops and on the road. But we've had to transition to virtual. But this will be, just imagine that we're on the road together, which would be fun because I don't think that both of you have been on the road with me yet. So how crazy would I drive you?
Not yet.
I want to see how you are in the car. Like, I just drive and drive and drive so you guys can sleep. But I'm curious if Estella would be able to sleep.
I probably won't. All the flights, we were traveling up to March, like we've traveled together, and I don't sleep. I don't get a lot of sleep, which is probably why my fibro fog is always acting up. I don't sleep. I am always talking, which is probably not a good thing. But I will tell you, we will be like that little, that little bus, that wheels on the bus go round and round. We will be chugging along, and we are going to be rolling through different states here in the U.S. and hopefully even internationally. So I'm looking forward to being on the road with you, Melissa. Just so excited that you included us, and that, again, you include everyone. This is about the whole community, which is something that I have yet to see. No one has done this before, and we're just so excited to be able to be part of this with you.
Well, let's join in the fun. I think we'll have to fight over what music we play on the road. See, what happens normally is when Michael is with me, like, he just sleeps, and it's okay because people sleeping in the car while I'm driving does not affect me. But it'll be a new dynamic with Estella, like, But you know, it'd be good. We'll have so many ideas. I think we'll have 100 ideas done by the time we like would have driven to like Albuquerque. So 13-hour drive, and we'd probably have so many ideas that would just save the world.
And I probably would have my laptop on me with my hotspot and hope that through the deserts I get some sort of signal, because that's just what I've done in the past. So.
I'm good with that because that's what Michael does in the back seat of I'm driving. You see these pictures from the back seat of me driving around the country because he's back there with his hotspot and working with 2 computers. So
I'll join in.
We definitely need a sprinter van or something with a bunk bed.
Oh yes, we need what is that called? Like the ones that you kind of haul. There's different kind of like a camper almost. Oh my gosh, I'm going off now. Now I'm thinking like we're on the road. This is
I think I could only handle driving a sprinter. So with the ones that are souped out, like when we worked with bands, they would have like some bunk beds in the back. There was no bathroom, but there are at least bunk beds so people could lie down, gaming stations, like workspace back there. So it's a sprinter size, so you don't need a different license to drive it, and you're not dragging something in the back. So
oh my. Oh, can this pandemic be over so we can actually be on the road?
Except I know sponsors out there, get ready a couple years. Coffee. I need a coffee sponsor. I need the Bulletproof coffee.
I was going to tell you, but that's who we need to ask, because since you've gotten that coffee for me, like I can't, I don't stop.
I will run off of Brain Octane, so I'll even have a t-shirt like for that, for Bulletproof. If you're out there listening, please me.
Yes, and all this talk about the tour, there was a special sponsor for this tour, right? It was a grant from Healthy Voices that you got, right?
Yes, we were gifted a grant. We got a grant from Healthy Voices. So the Impact Fund, which we were supposed to implement last year on the road, and they have kindly let us do this all virtual, which is difficult to do because with your grant, you're supposed to stay on point with the grant, but we were doing in-person workshops. So we have shifted to this, and we are grateful to have this be a part of the Healthy Voices Impact Fund. And for Looms for Lupus for joining us. So you're going to hear much more about this. So tune in. We definitely will wrap it up. So any closing remarks before we wrap it up?
Just that when we're talking about the vaccines, that there are more coming up in the pipeline. They're on phase 3 of the clinical trials. And I believe Johnson & Johnson is coming up with one as well. So looking forward to, maybe I'll hold off on getting these vaccines, even though I am going to get it, and see if that one comes up soon, then maybe I have more options. So just wanted to throw that out there. But again, thank you everyone for tuning in. If you have any questions in regards to anything we have discussed, please let us know. We are here for you.
Yes. And have a great weekend, everyone. We will see you next time.
Have a great weekend.